Hello again. I'm Richard Knight, President of the American Association of Kidney Patients. Thank you for joining us for the 47th Annual National Patient Meeting. As part of the AAKP initiated Decade of the Kidney, AAKP has purposefully targeted kidney research as a strategic priority for involvement and impact. Our national and global patient advocates and affiliates have been actively reaching out to all involved in the kidney science and research enterprise to offer their expertise and insights. At AAKP, we know that medical innovation and public policy are shaped by research, and without patients as active partners, future innovations in kidney disease and kidney disease care would not reflect our practical insights and lived experiences. Further, since research impacts public policy, including regulatory decisions and issues related to what new drugs and devices are paid for by government and private insurance, it is critical that patients work alongside research experts. Again, this is why you see so many messages from AAKP about opportunities to join a research project at a university through the federal government or Pcori. Our goal is to populate and impact every single kidney research project underway in the United States and across the globe. And as you will hear, we have been helped by research professionals in academia and government who want to work with you and AAKP. For today's session, Patient Consumers, Elevating and Including the Diverse Voices of Patients, I'm pleased to welcome several presenters whose work and personal commitment are for greater care choice and ending desperate health outcomes among communities who suffer the most from kidney disease. Next up is another good friend and one of our own, Dr. Janice Lee. Dr. Lee is a member of the AAKP Board of Directors and member of the AAKP Executive Committee. She is a professor of medicine at Emory University, clinical director of nephrology and telenephrology, and director of Emory Dialysis, and appointed member of the Nephrology Specialty Committee for the American Board of Internal Medicine. Dr. Lee, welcome. I gladly turn it over to you.
Hello, everyone. I'm Dr. Janice Lee from Emory University, nephrologist and AAKP board member. I am excited to talk to you all about my career and my work in healthcare disparities in chronic kidney disease and in hypertension. So, what I'll do is briefly talk about the work and the problem of disparities in chronic kidney disease and around home dialysis. I'm going to just briefly review some of the landmark trials and projects that I've been involved with around these topics, including the ASK trial, the NKDEP program, Pcori, and of course, our experience with COVID. I want to emphasize the importance of patient engagement in conducting research and in treating chronic illnesses. This is a slide that just sets the tone for why I am here talking to you about this topic. This is a slide that just shows the varying incidence rates by race and ethnicity for stage 5 chronic kidney disease or people that are on dialysis. And you can see the significant disparities by race and ethnicity when it comes to incidence and prevalence of chronic kidney disease. And then this was really my first major project and grant that I actually participated in and conducted research. This was the National Institutes of Health study, the African American study of kidney disease and hypertension, which is affectionately known as ASK. And this slide just shows you the geographic distribution of all the centers, all academic centers that participated in this project. You'll see me in here, the biggest picture that shows that I was the principal investigator here at Emory. But you can see there were numerous centers, a total of 21 centers across the U.S., primarily centered in the southeast and northeast, but also in the west coast, as you see. And this was a landmark trial that is still referred to in many publications, talks today when you talk about therapies for hypertension and kidney disease. We don't have time to talk about the results, but basically, the major sort of message from that study was that yes, it does matter what type of blood pressure medications are used in African Americans as well as other races when it comes to prevention of kidney disease. And it was definitely shown to be a benefit of using the ACE inhibitors, which most clinical studies have demonstrated as well. My next project was involved because of my efforts with ASK. I was asked to be a part of the NIH's National Kidney Disease Education Program, other known as NKDEP. And this was a nationwide effort to really enhance the education and communication around the problem of kidney disease in the African American population because of their disparate effects. I was one of the three national medical spokespersons for that. And so that was an exciting project where it was really just me and others going into the communities, coming up with special programs, health fairs, events, etc., to spread the word about kidney disease. And as a nephrologist, I take care of dialysis patients. I'm the chief medical director of our Emory dialysis operation, which serves a majority of the population is minority and predominantly African American. And so I've been really passionate about home dialysis. And this was an analysis that we did several years ago that looked at the utilization rate and the disparities around home dialysis. And as you can see, if you look to the left, the percent of patients on peritoneal dialysis, you can see for the whites, it was 11.4%, and the African American population, 6.6%, with the other races and ethnicities in between the two. And so this work just highlighted the need for more education and around home dialysis to make it more equitable in use of home dialysis. Now, there's very important and exciting work going on now to really uncover the causes for these disparities in chronic kidney disease and even in transplantation. And so, one of the major areas that is being heavily studied right now is work around the APOL1 gene, which is predominantly only found in the African American population. It's thought that 13% of African Americans have two of these abnormal risk variant or genes, and that predisposes them to chronic kidney disease. We know that 70% of patients with kidney disease who have HIV associated renal disease and focal glomerulosclerosis, 70% of those have these APOL1 variants. We know that this abnormal gene contributes to greater than 30% of patients with end stage renal disease who are African American. It's been shown to be excess risk for non diabetic kidney disease, so those with hypertension and other types of renal disease, and that it's associated with poorer outcomes in lupus nephritis, as well as shorter graft survival in kidneys transplanted from deceased African American donors. This is just a diagram to better depict what we're talking about with the APOL1 gene. Just briefly, there's a G0, there's a G1, and a G2. If you have two of the G1 or a mix of G2 or two G2s, those are the ones that are higher risk for kidney disease. If you have a G0 or a G0 with a G1 or G2, you're not at increased risk. You're just considered a carrier. The bottom part of this slide shows that 4 out of 5 people who have these 2 copies of the higher risk forms do not actually get kidney disease. So it's only 1 out of 5, or 25% or so, or 20%, that actually increase the risk for chronic kidney disease. So I'm actually involved. I'm on a steering committee, advising committee for the Apollo study, and also a local site investigator at Emory for the Apollo study. And what it is to actually identify persons who may have these 2 copies of the APOL1 high risk variant, and determine what the outcomes of their kidney transplant will be. And this will be for both the donor and the recipient. So this is very exciting work because we definitely need to know which of those 1 out of 5 patients with this high risk gene are at risk for progression of CKD, are at risk for poor kidney outcomes with renal transplant. So, what you all can do is just to spread the word about this important study in your communities. We know that especially in minority communities that there is less kidney donors that are registered. And so we want to spread the word. We want to let people know about this exciting project to really better identify which types of kidneys do better for kidney transplant. And so we want you to spread the word about this so that people can register to be a donor. And even for donors who are considering donation, to actually participate so that we can know whether or not they are high risk. And so for future transplant patients, they could benefit from this information. Now, we all are, still really in the midst of the COVID pandemic, and this was such a learning curve for all of us in many ways. And we certainly saw the disparities that we've talked about just really magnified in the COVID pandemic. So it was still, minority populations, African Americans, Hispanics at higher risk for COVID-19 related outcomes. And we know, and I participated in a study that we did at Emory where we analyzed our COVID-19 database to try to identify persons at increased risk for COVID-19 and poor outcomes. And what you see here is highlighted. These were the types of patients who had poor outcomes, those with diabetes, those with chronic kidney disease, and those with end-stage renal disease. Also, very interestingly, I did not participate in this work firsthand, but there are several publications now showing that some of these patients who developed acute kidney injury who were African American also had the abnormal APOL1 risk variants. So, very important data is emerging in these areas and will help us better handle these high risk patients in the future. Lastly, I just want to talk about my work in importance of patient engagement and for providers, clinicians, researchers to understand what our patients want. And so we know that our patients' priorities are just like anyone else. They want a good quality of life. They want to have a social life. They want to be able to work and be productive citizens of our society. They want to participate in their family milestones, their children, grandchildren, etc. They want to feel good. And for those, of course, with advanced kidney disease and on dialysis, the best life to afford that good quality of life is to get a transplant. But for those who maybe not be able to do that, at least to get to be on home dialysis where they can actually have a better quality of life. So, my recent project that was funded was the Pcori Grant, and that means Patient Centered Outcomes Research Institute. And I was so very fortunate to partner with the American Association of Kidney Patients, Emory I was a principal investigator for Emory, and we partnered with also Kaiser Permanente of Georgia. And our project was called Enhancing Patient Engagement through Peer Mentorship to Improve Outcomes in Chronic Kidney Disease Patients. So, what we did is we highlighted strategies to cope with the chronic illness, and we matched similar patients. So, we had patients who were either on dialysis or had a transplant, and we trained them up as mentors or ambassadors to train and to educate other patients and to help them cope with their illness. We developed educational materials, really helped developed and led by patients. And we wanted to increase the education and utilization of home dialysis and transplant. And so the ambassadors or mentors met with patients that they were paired with over a 6 month course of time and reviewed the materials. And then we evaluated how effective the process was. Now, we're going to be talking in more detail in later publications and sessions about our results of the study just finished up a couple of months ago, but we really received very positive information that this was an effective way to educate patients. And so we want to encourage others to include things like peer mentorship or other activities in which patients can be engaged to help benefit themselves. And we feel like it can be even more effective than coming from other healthcare personnel who haven't really lived the experiences as other patient mentors have. So, as I close, I want to just emphasize that when we talk about healthcare disparities and throughout my whole career and the different projects that I've been involved in, the first thing that has emerged to me and many others as most important is education and patient engagement. We can create new medicines, new therapies, but if we can't get them to the patient and get them to buy in and to understand why they need to take certain medications, etc., then they're not going to be effective. So we have to put the patient first in their ability to be able to access whatever treatment is available. We know for many years that early detection of kidney disease and early referrals to nephrologists are key in helping to slow progression of kidney disease. We, of course, need to get adequate treatment, new therapies, but again, access to those treatments for our patients. Adequate access to health care, patient advocacy is so important. Local government, medical organizations, patient led groups such as the AAKP are just vital in helping to partner with medical professionals to achieve the outcomes that we want. Certainly, the COVID pandemic has put a focus on the need to build trust between the providers and the patients. The whole issues with the vaccines early on, there was a lot of distrust of the government, etc. And so it's just really important for communities to be engaged in the process and for outreach to better identify with these patients who need our help. I've emphasized the important role of peer mentorship, and hopefully, this is something that will be used more and more in other types of projects to reach our patients. And then, as always, we need more clinical research, such as the exciting research going on with APOL1. Hopefully, one day there will be a treatment for APOL1 and other types of processes that have been identified as important, that play important roles in progression of chronic kidney disease, and especially targeting the underserved populations so that we can better understand their risks, both social and biological factors that impact their outcomes. This is my motto: patients engaged in their own care have better outcomes. As Dorothy says in The Wizard of Oz, there's no place like home. And I like to say, when we talk about dialysis, we know that there are better outcomes, and there's definitely disparities around home dialysis. So we need to increase our advocacy efforts to increase utilization of home. And then also, I say this because of the COVID pandemic, that we've learned, i.e., this meeting is virtual and we're at home. And so we've learned to really function in the current state. And I think many of us enjoy that flexibility of being able to do so and still being able to be effective in reaching people with our important messages. So, with that, I'll close. Thank you again for your attention, and I look forward to our discussion section later.
Thank you, Dr. Lee. It's always great to have you join us.